Coronavirus quickly spreading to various regions of the country, with the number of cases in New York State also continuing to rise. Our Jasmine Allen is in the studio with an update. Jasmine.
Thank you, Thomas. Earlier this afternoon, Governor Cuomo reported 142 cases of coronavirus in New York State. That's an increase of 37 new cases since his initial statement of 89 cases reported on Saturday. I spoke to the medical director of Rome Memorial Hospital about new information on the virus and how the community can help protect themselves.
We're having more cases nationwide as we expected. The virus is going to roll through communities.
As of Saturday, Governor Cuomo declared a state of emergency for New Yorkers. Dr. Bushnell describes coronavirus as more deadly than the flu and typically only a serious threat to older people or those with lung, heart, or pulmonary conditions. Like other communicable diseases, coronavirus can be transmitted from contact with someone who's sick or from a surface.
The risk factors are that it is on surfaces that we touch. I don't know the exact hours, and I don't know if anybody has tested the exact hours that it exists. I do know that if you touch a surface and then touch your face, your mouth, your eyes, you're at greater risk of transmitting what's on that surface.
Health professionals say the best way to avoid getting sick is to practice good hand hygiene and to avoid large crowds of people. Many people have begun wearing masks in public, but Dr. Bushnell argues that this may have a reverse effect.
What the experts are saying is that wearing a mask makes you touch your face more than if you didn't wear the mask. So people who are adjusting their mask, they're putting it on, they're adjusting it on their face, and they're actually transmitting what they're touching on surfaces to their face more than if they weren't wearing a mask in public.
And you may want to think twice about traveling to a foreign country.
Getting in a crowded place, going to foreign countries that might have different standards of control of the virus may put you at some risk that we can't control here in the United States.
The CDC says symptoms include a fever, cough, and shortness of breath. Dr. Bushnell says in most cases with healthy individuals, it will mimic a cold and run its course on its own.
Most people, 85% or greater, will not need anything more than just a couple days at home to get better and to make sure that they no longer have this virus.
We want to hear your thoughts. Email us your questions and comments about coronavirus to news@WUTR.TV. Dr. Bushnell will be live in the studio this Thursday to answer your questions. Reporting in the studio, Jasmine Allen, Eyewitness News.